Hello, good morning, everybody. Let us discuss some of the important issues regarding clinical case studies and understanding of anemia in children. First, we shall see the basics of anemia. What is anemia? And anemia is a condition where there is reduced RBC or deoxygenated increase in the deoxygenated RBCs. Every cell and metabolic activity of the body is affected by anemia. When there is anemia, there is a decreased oxygenation of the blood, and as a result, there is a decreased supply of the oxygen to the cells, and as a result, the metabolic pathway or metabolic activities which is going on the cell is get affected. Therefore, anemia causes a generalized problem. Low hemoglobin affects almost all the tissues, cells of the body, which leads to fatigue and irritability. When metabolism is decreased in the muscle cells, it leads to fatigue, and the same metabolism is decreased in the nerve cells, it leads to irritability. The RBC is produced in the bone marrow of the long bones and as well as flat bones. Development and maturation of the RBC is a big process. As we know, there is formation of erythroblast in the beginning, which later pass on to the stage of early normoblast, intermediate normoblast, late normoblast, erythrocyte, reticulocyte, and then RBC. During this stage, the size of the RBC goes on decreasing and nucleus which is present in the RBC goes on disappearing. The nucleus will be later replaced by hemoglobin, and at the end, when there is formation of RBC, the size will be 7 microns with hemoglobin inside it, and cytoplasm is very less, but the cell membrane of the RBC is very strong and thick. The first cell in the circulation is reticulocyte. This has got less half-life and later becomes RBC in the blood. Bone marrow is always in hurry when there is a need of when there is need, as it occurs in case of hemolysis. If the hemolysis is more, the spleen will have to work more and it will going to enlarge, followed by the liver and reticuloendothelial system. Now, when we say pallor, what are the possibilities? Of course, when there is a pallor, there is anemia, but pallor also suggests poor circulation. Pallor can be also seen in case of hypothermia. Pallor can be also seen in acute conditions with the stress. There may be sudden peripheral vasoconstriction as it occurs in case of fever may also lead to pallor. Pallor will be also seen in shock. There is also waxy pallor, which is very characteristic of nephrotic syndrome. That means in nephrotic syndrome there will be edema, and this edema will mask the pallor, but if you stretch the skin, the pallor is visible. This is called as waxy pallor. All the above conditions, the pallor is transient, whereas if the anemia is due to hematological causes, then the pallor is continuous, stable, and progressive. Basics of anemia. We have to see the pallor examination. Pallor has to be examined by looking at the conjunctiva and especially the bulbar conjunctiva. Pallor can be also seen in the normal palm. The palm of the patient has to be checked with the palm of the doctor, provided doctor is not having any anemia. It can be also seen in tip of the tongue. And one of the important areas to check the anemia or pallor is palmar creases, which becomes light pale. Sensitivity may changes from patient to patient. And these are some of the pictures which shows no pallor, pallor, and severe pallor. And the first picture is suggestive of examination by palm. Second picture is palpebral conjunctiva, and third picture is the tongue. You can appreciate the severity of the pallor in these three pictures. Now let us look at the paler without jaundice. There is only pallor, but there is no jaundice, and sometimes there is a pallor and there is also jaundice. The two conditions will go into differ. Only pallor is there without jaundice may be seen in case of deficiency problems like iron deficiency anemia, or maybe B12 deficiency or some other vitamin C deficiencies. It can be also seen in case of bone marrow problems. This can be also seen in case of hemorrhagic problems. In these three conditions, there is no jaundice. Jaundice will be there only when there is excessive destruction of the RBCs. In all these three conditions, there is no destruction of the RBCs. In all the hemolytic anemias, like autoimmune hemolytic anemias, maybe some of the hemolytic problems or congenital hemolytic anemias, there will be jaundice. One of the exception is thalassemia. Now, in case of iron, B12 and vitamin C and folic acid, as we know, these are the important hematonics. These are required for the formation of the RBC. Apart from these, the other substances like zinc, vitamin E is also important, especially in preterm. And these are the conditions when we get pallor without jaundice. Pallor with jaundice together is seen in case of excess RBC destruction. In this condition, once the RBCs get destroyed, bilirubin will go into increase because of heme metabolism, and as a result, the bilirubin is converted, biliverdin is converted into bilirubin, and this bilirubin undergoes the conjugation, and that leads to jaundice. There are different types of anemia. Although we can see different types of anemia and different causes of anemia, for the clinical purpose, we will describe or we will classify them under 4 headings. Number 1 is deficiency anemia, number 2 is hemolytic anemia, number 3 is bone marrow problems, and number 4 is severe hemorrhagic anemia, and last one is infectious anemia. In the clinical setup, if we are able to identify these 5 conditions of anemia or 5 causes of anemia, it is more than enough for the treatment. Now, different types of anemia, how to understand? Just give an example. You go to a shop and ask for a pen. The shopkeeper says there is no stock. Then you just ask why there is no stock. Then he says, sir, factory is not producing such pens now. Then I again asked, why factory is not producing such beautiful pen? He says, factory is on strike, sir, so workers are not working. Then I got the address of that factory and I visited the site of the factory. When I see the factory is running, I called one person and asked, factory is running, but why there is scarcity of the pen in the market? It is not reaching the market. Now let us understand the same scenario. In case of bone marrow anemia, what that person is, the first we are discussing about bone marrow anemia. So that person told me, sir, factory is running, but production is very poor or very less. This condition is nothing but anemia due to bone marrow aplasia. Everything is there, but stem cells are present, and therefore it leads to bone marrow aplasia. Again, he told, sir, factory is running, but it is captured by some lobby. They are not allowing us to produce the normal pens. They appointed their own members with less efficient workers. This leads to anemia, and this is nothing but bone marrow infiltration. The normal bone marrow stem cells are get infiltrated by some blast cells or some other cells which are less efficient and not able to produce the RBC. Again, he told, sir, factory is working, but not paid properly. Therefore, workers are not doing well. So workers are depressed, and this is a condition of bone marrow depression. Bone marrow depression can occur because of the toxins, because of the drugs or some other causes. Again he says, sir, factory is working, but some of the other materials are stored here instead of the pen. Means he says that the factory is utilized to produce some unwanted substances, and this is a condition of a bone marrow storage disorders. Now, to summarize this story, bone marrow anemia may be because of bone marrow aplasia, bone marrow infiltration, bone marrow depression, or bone marrow storage disorders. Now, these are the four important causes of anemia with involvement of the bone marrow. In these conditions, there is no involvement of the liver and there is no involvement of the spleen. There is no formation of the jaundice. The reason is the RBC itself is not formed properly. Then there is no question of destruction and there is no question of heme metabolism. So possibility of formation of the jaundice is zero. But very important finding in this case is child will be sick looking. Child is not having hepatomegaly. Child is not having splenomegaly. Child is not having any other symptoms like jaundice, but still child is very dull looking and sick looking with the appearance of chronicity. That is how we have to identify a paler with bone marrow anemia. Now, I again asked one more worker there and I asked him why the pens are not reaching the market. And he has given a different answer. He told, sir, sometime factory is running, but the product is not reaching the market because there is no truck service. Okay, so then it should be understood as there is some transport problem. RBCs are normally produced from the bone marrow, but it is not reaching the target area. It may be because of RBC enzyme defect, or it may be because of the size of the RBC, or it may be because of shape of the RBC. They are not able to reach the site like circulation or cells. He again says, sir, sometimes truck is there, truck service is there, but there is no drivers. There is no drivers. And this indicates that the truck is there, that means RBCs are produced, but they are not reaching the proper site because there is some hemoglobinopathies. And sometimes driver and truck both are there, but while carrying in between, somebody looted it. Therefore, it is not reaching the market. This suggests some autoimmune hemolytic problems which destroy the RBC prematurely before it reaching to the site. So, this is a case of hemolytic anemia. This story suggests the story of hemolytic anemia. Hemolytic anemia is a condition where there is premature rupture or destruction of the RBC. This premature rupture may be because of RBC enzyme defect, maybe there is some problem in transport, or maybe there is some autoimmune reactions, or maybe some of the structural problems like spirocytosis, etc. And in this condition, definitely, as there is over destruction of the RBC, the heme metabolism takes place, and as a result, there is formation of more and more bilirubin. And as a result, patient will be evident with jaundice. Meantime, the destruction work will be taken place by the spleen and afterwards by the liver, so there is every chance of a splenomegaly and hepatomegaly. So, anemia which is developing because of hemolytic anemia will be characterized by the pallor, jaundice, hepatomegaly, splenomegaly, and some other symptoms. If it is an autoimmune cause, the course is very rapid. If it is some of the congenital hemolytic problems, then course may be little delayed. Now, continuing with the story, the factory owner says, sir, every story is false, everything is fine. The problem is owner is not providing us the raw material. When there is no raw material, how can I produce the pen? This is the version of the owner. So what happened? Sometime he says everything is there, but there is no raw material for the production. In the context of anemia, raw material refers to the hematonics, maybe iron, maybe vitamin B12, maybe vitamin C, and maybe folic acid, vitamin B6, etc. Okay, so sometimes everything is there, but some kind of problem will be there. Owner also says that, so in this case, where owner says that deficiency anemias. When we talk about deficiency anemia, it may be iron deficiency anemia, it may be B12 deficiency anemia, it may be vitamin C deficiency, vitamin E or vitamin B6. Now, deficiency anemias will always going to develop very slowly. They will not produce any rapid drastic symptoms. Patient will be active, child will be active. Maybe he is tired very early or he is exhausted very early, but still he is active. All the deficiency anemias will have an active child. Now, deficiency anemias will have two types: complete or generalized deficiency and selective deficiency. There may be deficiency of iron only. There may be deficiency of iron, B12, everything. The symptoms will going to vary. Although there is deficiency of the iron in the first case, selective deficiency, all the other things are normal. So patient will not be sick. He will be active and happy looking. Whereas in case of all the problems, deficiency of all the hematonics, then patient may have some more symptoms. So it's very clear, in case of deficiency anemia, there will not be any jaundice because there is no over destruction of the RBCs. There is no bone marrow involvement. Bone marrow is also doing well. Therefore, there is no sick child and child is active. And in case of bone marrow efficiency, in case of deficiency anemias, there is no liver and spleen enlargement. And only thing is, child will be exhausted, tired after doing some exercise. Exercise tolerance will be less. And this is the type of anemia which is most likely missed because patient will not exhibit any much more symptoms. Now, if you continue the story, owner also says that sometimes we prepare the product, sir, but the road is very dangerous and so accidents are very common and therefore we are not able to reach the spot in time. This suggests towards an hemorrhagic anemia. Most of the time, hemorrhagic anemia may be because of some of the trauma or some of the accidents. Sometimes hemorrhagic may be also because of occult causes. There may be some occult bleeding, maybe because of some worm infestation or maybe because of some intestinal problems. And some of the problems where the frank blood has been lost from the body is some of the trauma, internal bleeding, hematuриas, and most commonly piles, hemorrhoids, and fistula in ano. So sometimes people stole in between. This is what owner says, occult bleeding like. So few people will take away the products illegally, so without any records. That means loss of blood, loss of the frank blood. Now all these stories suggest towards an hemorrhagic anemia. Hemorrhagic anemia. In hemorrhagic anemia, everything is normal, but there is loss of the blood. There is no liver and splenomegaly. There is no involvement of the bone marrow, and there is no jaundice. But still patient is hemorrhagic. This is common in case of hemorrhoids, in case of menstrual problems, in case of occult bleeding, in case of worm infestation or some other traumas. Now this is a graph representation of what we have explained so far. So far we have seen the four types of anemias. If you are able to clinically identify these four types of anemias, it is well and good. In the deficiency anemia, we have got iron deficiency and B12 deficiency, and liver is not enlarged, spleen is not enlarged, jaundice is not there, and growth is affected because we know that oxygenation is required for each and every body cells. So if it is not provided for a long time, definitely the growth will be affected, and there will be nail changes, there will be hyperdynamic circulation, there will be knuckle pigmentation in case of B12 deficiency. Now when I consider this particular deficiency anemia in terms of Ayurveda, when I treat, the treatment will going to change. So here mainly I have to go with the supplementation. Either I have to go with the iron supplementation or I have to go for vitamin B12 and vitamin C, etc. supplementation. The drugs like Dhatri Loha, drugs like Saptamrita Loha, drugs like Lohasava, Punarnava Mandura. So these are the drug of choice in this condition, provided along with the green leafy vegetables and good amount of fiber and the folic acid in the diet. Come to the second part, that is hemolytic anemia, where there is excessive destruction of the RBCs. In case of hemolytic anemia, we will again classify these hemolytic anemias into two types as congenital hemolytic anemias and acquired hemolytic anemias. The congenital hemolytic anemias are again the most common thalassemia, spherocytic anemia, sideroblastic anemias, and also spherocytic anemias and sickle cell anemias. These are some of the very important congenital hemolytic causes. In this condition, the RBC which is formed is not up to the proper shape and size, and as a result, their lifespan will be reduced and they will go into destruct very early by the spleen. Again, in congenital anemias, the liver will be enlarged, spleen will be enlarged because they are doing extra work of destruction. Of course, there is an exception for the thalassemia. In the thalassemia, the formation of the jaundice, in all other hemolytic anemias, there will be jaundice because excessive destruction of the RBC leads to the iron metabolism increased and formation of the bilirubin, and jaundice is expected. But in thalassemia, as the destruction takes place in the early part before the entry of hemoglobin into the RBCs, the jaundice develop in the later phases. Or in mild thalassemia, there may not be jaundice. In intermediate or severe thalassemia, there may be jaundice. But in all the other hemolytic problems like sickle cell anemia, spherocytic anemia, definitely we will have the jaundice. What about the growth? Yes, growth is stunted. Growth is stunted because RBC lifespan is reduced and we are not able to provide the good amount of oxygen to the cell continuously. Very important is hemolytic phases. In case of hemolytic anemias, we will have hemolytic phases. Why? Because RBCs are destroyed early, so body will produce more and more RBCs. It may be immature RBCs, but it will produce it. So in the process, many of the bone marrows are involved, especially the facial and cranial bones are involved, and their cortices get enlarged and stretched, and that leads to typical hemolytic phase. Some of the other signs may be there. Liver is enlarged, spleen is enlarged, some compression effects may be there. So now this hemolytic anemia is a congenital and as well as acquired. In the congenital, so far we have seen. But when we come to the acquired hemolytic anemias, because of some autoimmune problems, when there is some autoimmune problems, we will have, suppose an infection taken place. After the infection, there is exaggerated immune response in the body and it produces some of the auto antibodies against the RBC, and RBC start destruction, and that leads to hemolytic anemia because of acquired causes. Now here, liver will be enlarged, spleen is enlarged very fastly. Jaundice is developed very fastly because it's an acute cause. Autoimmune is an acute cause. And growth is not much affected because the course is very less. Just it's a problem of 1 month. Okay, in the 1 month everything is taken place. So growth is not much affected. Weight may reduce to some extent. Now, when we talk about hemolytic and acquired hemolytic anemias in terms of Ayurveda, so they are considered as the asadhya causes. So alparakta, alpameda, nissaro, shitilendriyaha. This is what is told by Charaka in the context of Pandu. So these are the typical such conditions. So alparakta, there is anemia. Alpameda, there is less bone marrows. So alparakta, alpameda, nissaro, shitilendriyaha. So treatment in these conditions should be considered as Tikshna Shodhana or Virechanas according to the strength of the patient. Anyhow, we should know that we are treating an asadhya disease. If it is acquired hemolytic anemias, this can be stopped by giving some of the rasayana drugs. Whereas if it is a congenital hemolytic anemias, the aim should be given to maintain the normal status of the body by giving a symptomatic treatment. So we can administer some of the drugs. But one thing is very important. When you are treating congenital hemolytic anemias or acquired hemolytic anemias in Ayurveda, the very important thing is already there is increased iron store in the body, because excess hemolysis is taking place and iron is reabsorbed and hemosiderin is formed, and more iron is already stored in the body. Excess iron in the blood itself is a big problem. In such conditions, if you are giving the preparations like Dhatri Loha, preparations like Punarnava Mandura, then it may add to the problem of iron storage. So, better to avoid iron storage or iron preparations in this condition, rather you go for the Shrotoshodhana drugs and the Panapachana drugs and some of the Rasayana drugs. Let's come to the aplastic anemia, bone marrow anemias. In the story, we have seen there are bone marrows, bone marrow infiltration, bone marrow depression, bone marrow storage disorders, and also the bone marrow aplasia. In bone marrow aplasia, as I told earlier, there is no involvement of the liver, there is no involvement of the spleen, and there is no jaundice also, because RBC itself is not formed. Then there is no question of destruction, there is no question of formation of the jaundice. Okay, so growth. In bone marrow causes also, the growth is not much affected if it is a recent origin. If it is a late origin, yes, chronic origin, then the growth is affected. But only and only symptom in case of the aplastic anemia is to identify clinically is child is very, very sick. It's a sick looking child. Chronicity, growth failure will be there. If you see the growth velocity chart, it's down. Only in case of some of the acquired bone marrow problems, growth may not be much affected. Otherwise, it is affected. Now, how to treat this aplastic anemia in terms of Ayurveda? Aplastic anemia is basically the problem is there in the bone marrow. Again, it is an asadya disease. So, alpa rakto, alpa medo. Okay, so the sarakta medha is considered as one of the bone marrow present in the small bones. So, here the focus should be given to increase the medhas. If it is a bone marrow aplasia, try to increase the bone marrow. Majjam majjena vardhate. Okay, if it is considered as majja, then give some of the majja preparations. Then similarly, if it is a bone marrow problem, some of the rasayana drugs can be given. Okay, some of the animal majjas can be given. And even some of the majjas like Vibhitaka majja or Aragota majja or Kolasi majja can be given, as we believe in the principle of majjam majjena vardhate. Otherwise, the rasayana, jivaniya and brahmaniya drug should be administered. The last one is hemorrhagic anemia. Hemorrhagic anemia, there is blood loss. So blood has to be supplemented. So, or blood supplementation means you can give the hematonic supplementation. It may be, again, just like a deficiency anemia, iron supplementation, vitamin C supplementation, vitamin B6 and vitamin B12 supplementation should be considered. Apart from this, there are two other conditions where there is deficiency, where there is anemia. One is leukemia. In case of leukemia, there is infiltration of the blast cell in the bone marrow, and as a result, the RBC producing stem cells are get reduced. In this condition of leukemia also, there is no anemia will be there. Of course, we know that in case of leukemia, pancytopenia will be there. That means everything is destroyed. Only the blast cells are increasing. So, liver, spleen and jaundice will not be there. Growth to some extent it will be normal, but bony tenderness is very, very classical. Bony tenderness will be seen. Another condition is storage. In case of storage disorders, also there may be anemia. When the storage occurs in case of bone marrow, there will be the problem. Okay. So this is about the classification of four types of anemia in the clinical practice, and how we have to see these problems in Ayurvedic perspective. The thing is, in all the anemic conditions in children, we cannot go for iron preparations. There are some limitations. The best treatable anemias in Ayurvedic practice is deficiency anemias and to some extent autoimmune anemias. Bone marrow anemias are very difficult to treat. Of course, we can try. With this, we conclude this particular session. Thank you very much.